Hello and welcome to Talking Africa, the podcast that gets behind the news from the continent by the Africa Report. My name's Nick Norbrook. Welcome to the show. I hope you enjoyed that barnstorming conversation between Tom Burgess and Patrick Smith last week. If you haven't, I recommend you give it a go. It talks about Kleptopia, Tom's new book on corruption that starts out in the dying days of the Soviet Empire, loops through Congolese mines, and ends up in the White House. Some quick housekeeping. If you're listening to this before 3 p.m. Lagos time on Thursday, the 24th of September, then please know that we are holding a live event with Nigeria's Vice President Yemi Osinbajo. Head to theafricareport.com for more details and for all our news, views, and analysis. Today on the podcast, we speak to someone who's been in the news a great deal recently. People across the continent have been tuning in to hear Dr. John Nkengasong's briefings about the coronavirus pandemic. The head of the Africa Centers for Disease Control speaks to us about the fight against COVID-19, Africa's triumphs and tribulations, and the big changes that need to happen at the highest level for frontline healthcare to be given the time and money it deserves. So I wanted to jump straight in with a difficult issue. South Africa has lost over 240 medical workers to COVID-19. Many have gone on strike because of a lack of access to PPE. Much of the money directed to purchasing PPE has gone missing in Kenya, in Uganda, and elsewhere. What can be done about this?
First of all, we must collectively condemn this behavior and condemn it strongly, because this is a human rights issue. I mean, we are in the middle of an unprecedented pandemic, an unprecedented disease threat that is creating a serious security threat for our continent, a serious economic threat for our continent, a serious health threat for our continent. So to see those kind of behaviors is totally unacceptable. I think that is one. I rely and remain hopeful that the government of South Africa would conclude its investigation and bring those people to order and penalize them appropriately, because this is absolutely not acceptable. It's a lack of self-discipline, consciousness, and the collective good of the people of South Africa.
There's an argument at the moment about why exactly African countries have been less affected. What for you has been the greatest factor? Is it the fact that Africa locked down relatively early? Is it the demographics? Is it the lack of integration into global travel and logistics? Do we know what the major factors are?
I think we know some of the factors that have contributed to this the current pandemic situation in Africa, which I call a delayed pandemic. The first thing we have to I always highlight in my public speaking is that we are not out of the wood yet. So I think it's not yet at all time for us to be describing the situation like in the past. I think we are still in the middle of that storm, and that is very clear. We had a delayed pandemic because we were fortunate to see this situation, the COVID-19 pandemic, unravel in China, unravel in Europe and the United States. Our first cases hit the continent in Egypt on February 14, to be very specific. And on February 22nd, we convened a meeting here at the African Union Commission. That means we, the Africa CDC, and that meeting was chaired by Chairperson Musa Faki of the African Union Commission, where all ministers of health came, and to agree that this was a significant threat to consider a joint continental strategy. So we did develop a joint continental strategy. It was the first time in the history of my 32 years in public health that within 1 week we convened ministers of health, and they could all of them come to discuss that. So shortly after that, there was this a sense of unity of purpose focus and collectivity that was driving the continent. So I think the first thing is the leadership acted in a very smart way, in a very determined and decisive way very early on, and by closing down, locking down. Of course, it had serious implications on our economies, but that is very, very important that we note that as we document the history of this pandemic. I'll give you some statistics here. In South Africa, if they hadn't locked down, they would have seen a 50% daily increase in the number of new cases in the country, the way it was progressing. The lockdown way the country had reported close to 800 cases, but if they didn't do that, the current situation in South Africa would have been worse. I think, and many other countries that we have statistics for follow similarly. So I think that is one. High-level leadership, coordination, and early measures that they took in locking down. The second factor we believe is playing an important role in this is the structure of population, the demographics. I mean, more than 70% of our population are less than 30 years, and these people are, of course, we know from the experiences in China, Europe, United States, that this population definitely is infected, but they just don't come down with diseases. And we are seeing that on the continent. The vast majority of the infections are symptomatic. I mean, whether you look at the data in Kenya, Uganda, Cameroon, Ethiopia, they are symptomatic. You keep them, you go to the treatment centers, they are all they're healthy and not falling sick. So I think those two factors have really played an important role. Now, the unknown is that we still don't need to analyze our data to understand what is going on with the 1 million people that have recovered. Who are these people that have recovered? We still need to analyze our data to understand the 33,000 people that have died. Who are they? Why did they die? And other and determine other factors. We still need to also look at the genetics of the population and also the use molecular analysis to understand the changes of the viruses. So there's still a lot to be done on the continent to understand why we are where we are with our pandemic. But clearly, those two factors that are indicated are very important. And lastly, and not the least, and I don't have data for that, is that maybe, and just maybe, that because we are not terribly networked as in Europe or the United States in terms of subways, trains, and a lot of air movement, that could probably have played a role. But again, I just don't have data for that to put that on the table as a possibility.
Just to understand how the Centers for Disease Control operates as this Pan-African Federation, how do you interact with, for example, the CDC CEO in Nigeria, Chikwe Ihekweazu? Do you have, weekly meetings? How much autonomy do they have? How does it work as a federation?
Well, that's a great question. The CDC, the Africa CDC, is a specialized technical institution of the African Union. So we are to the African Union as the European CDC based in Stockholm is to the European Union. So I think that is one. Then the second thing to understand about our structure is that we do have 5 regional collaborating centers in Egypt, Nigeria, Gabon, Zambia, and Kenya. Okay, so I think those are the 5 regional centers. Now, those are the centers that we have direct control over them. That is, they are part of the Africa CDC headquarters in Addis Ababa. Now, in terms of functionality, we do connect with the National Public Health Institutes in all member states. And the Nigeria CDC that you mentioned is an example of a National Public Health Institute that we do connect with them, but it's a dotted line. We don't have any authority over them because these are national structures. But we do have functional relationships with them that we've established ourselves as a network of public health agencies on the continent to constitute a response platform. So in the context of this COVID COVID-19, we have established what we call the African Task Force for Coronavirus Preparedness and Response, which was endorsed by at the level of the leadership of the continent, what they call the Bureau of the Head of States, by President Ramaphosa and in his capacity as the chair of the African Union. And that task force meets every Tuesday at 4 p.m. Ethiopian time, and where all the people that you mentioned, the Chikwe, the Marufi, the director of the Pasteur Institute in Morocco, the Nathalie, the head of the National Communicable Institute in South Africa, and others, all come together and we discuss and coordinate action. So I think this is unprecedented in the history of fighting diseases on the continent, that we all come together on a Need One platform to coordinate efforts and share country experiences. Each week, the first 30 minutes is devoted to a given country sharing their experiences as to how they are fighting COVID in the country, and then we do that successively. Then we open that up for guidance and then shape the strategy as we go. So that is the functional relationship we have with the national Nigeria CDC and other similar institutions, including the Pasteur Institute in Senegal, headed by Dr. Amadou Sarr.
I'm sure you're fed up of having to answer questions about this, but with the United States pulling out of the World Health Organization, does that increase the burden on CDC operations? Will it make your work with these affiliates more important? Do you have the funding for it? How does that work?
So the funding for the Africa CDC up to this point, that is before COVID, was 100% funded by member states. I think that is the Africa CDC is not an affiliate of the United States CDC. I think the one thing we must really recognize and propagate is that for the past close to 4 years of the functioning of the Africa CDC, the member states have really supported that. This doesn't exclude the fact that we have partnerships with Nigeria, with US CDC through technical advice, and then China CDC, the Public Health England, they all have seconded staff that technical officers that they are supporting us with. I think that is very, very clear. So back to the question you asked is that so let's remove COVID from the equation and look at it, what the United States contribution and leadership has been on public health on the continent. If you look at areas of polio, malaria, HIV, there's absolutely no doubt that the continent of Africa owes the United States a ton of gratitude for what they've done over the last decades to fight these diseases. I mean, PEPFAR has spent over $80 billion on the continent for the past 15 years to fight HIV/AIDS. If you recall, before PEPFAR started and the Global Fund, we were beginning to see loss in life expectancy on the continent because of the impact of HIV/AIDS. And then PEPFAR came in and we are seeing the continent coming back. So the point I'm making is that the world and Africa have always been in a better place with the leadership of the United States. Absolutely no doubt about that. And I think we see that across the Global Fund. I think the United States contributes significantly into the Global Fund, which is, to me, the best thing that has happened in the history of humanity to fighting diseases collectively. And it speaks to the fact that we're human beings recognizing a threat to other human beings and deciding collectively to respond to that through the Global Fund. And the contribution of the United States is extremely valued in the functioning of the Global Fund. All of this just to say that it's clearly going to be a significant setback on the manner in which we fight diseases on the continent without the strong leadership and support of the United States. The Africa CDC is not as endowed as it will be. It will be in future. We are moving towards that, and we hope that with the COVID-19, member states will contribute more, and they are contributing more. The head of states are making continuous pledges to supporting our budget envelope, and we really hope that the partnership with the United States will continue, and the leadership with the United States will continue as we fight this pandemic.
Do you see an incremental improvement in African healthcare cooperation from HIV/AIDS through Ebola to COVID today? Or are we seeing nationalist responses and border closures getting in the way of that?
No, I think we have seen. I was reflecting on this question over the last week. What we've actually learned as a continent. We've learned as a continent that we've learned to take our future into our hands and work through cooperative mechanisms, collaborative mechanisms, coordinating mechanisms, and communicative mechanisms. I say this because, I use COVID as an example. The experience I just described to you about the AFCOD, the Continental Coordinating Task Force,